think we're good to go. Okay, so I want to start with a show of hands. Who's passionate about healthcare? Who thinks our healthcare system needs improvement? Okay, who thinks politics belongs in healthcare? Who supports withholding of vital information about the healthcare system? How about muzzling healthcare workers who speak up about these issues? My name is Penny Daflos. I'm a reporter with CTV News. I'm a multimedia journalist, or what we call in the industry a one-woman band. I shoot most of my own interviews. I edit my own stories. I produce, I write. I do it all by 6 p.m. each day. 4 jobs, 1 salary, which I think most of the healthcare workers in this room can empathize with. I've interviewed some of you while covering the pandemic and the deterioration of our healthcare system. And for every healthcare worker you've seen in one of my stories, or another 3 or 4 who've spoken to me in confidence because they fear repercussions if admin finds out they've spoken to me. So why speak to a reporter? Again and again, I've heard the public needs to hear the truth because they're not getting it. Patients usually only see the tip of the iceberg. We're talking long waits, reduced access, rushed diagnoses, all signs of a faltering system. I've never worked in healthcare myself, but I've interviewed or spoken with, in some capacity, nearly 200 healthcare workers to get their insight. And that's good journalism because we need as many sources as possible. What's been toughest accessing is official, reliable information that tells us how it's going for patients, for staff, for the entire system. This is where my favorite Hemingway quote comes in. I don't know if you've heard it. How did you go bankrupt? Gradually, then suddenly. That's what's been happening to public confidence in the management of our healthcare system. Wait lists grow, little fees get introduced, more people don't have a family doctor. This happens gradually. We knew there were cracks in the system, and the pandemic forced those cracks into chasms gradually, then suddenly the system falters. Long waits, occasional hallway medicine in hospital, now the daily norm gradually, then suddenly, and mild fatigue has turned into chronic exhaustion. COVID-19 accelerated this, so what happens when journalists try to get government data about BC's pandemic response? Well, some info is offered up, heavily colored by spin. You've seen the euphemisms about strain on the healthcare system and platitudes about hardworking staff. But 2 things have also become very common: stonewalling and redactions. I'm glad to have this format to talk to you because I want you to see what happened when I tried to get information about COVID outbreaks in BC hospitals. First, I asked nicely, the health authorities delayed, then told me to make a Freedom of Information request to decide how much to show me. This is what Fraser Health produced. As I got this from Fraser Health, Vancouver Coastal Health claimed they did not document outbreaks in hospitals. Long story short, I fought them, and then they said, wait, we have too many results, you're going to have to narrow it down now. 1 full year after I first asked, this is what I got from Vancouver Coastal Health. 256 pages of paperwork I was initially told didn't exist. So why is this important? And I can tell you this isn't just Penny finds it interesting, so you have to tell her, or me getting on my journalistic high horse. That's not what it is. In the first year and a half of the pandemic, 1,619 people caught COVID-19 in a BC hospital. They walked in the doors for something else, a broken arm, abdominal pain, something else. They got the virus that made them sick, and 274 of them died. Was this a lack of PPE, poor ventilation, same problems over and over again, or new things? I believe some of those answers are behind that black ink, and they're important. They're important for workers in the system. They're important for patients weighing personal risk. Later, we tried to learn how our government was making decisions about COVID. It may not surprise you I had to file another FOI request because I was trying to find out, were they making decisions about public health measures like masking based on popular opinion or despite it? This is what I got back. More than 400 blank pages. Polling data specifically can't be withheld under the Freedom of Information and Privacy Act, and yet they did. And I know I look amused in this photo, but that is not the correct word for how I was actually feeling when it got that response back. So what actually happened was they withheld pages 2 to 413 and a scattering after, but they didn't want another pile of black pages like I got on that other result. So instead they said, we're just not going to show you. And I wanted to illustrate to people like yourself, to the general public, what was being kept from you. So I just counted out 1 blank sheet for each page that was withheld. It seems like a comical cat and mouse game, I know, but this amounts to what I've been calling weaponizing of freedom of information. Our government and health authorities have been fighting what should be routine disclosure, and they're forcing newsrooms they know are struggling with layoffs and cutbacks Constantly struggling, I'm telling you, on a daily basis. They're making us take valuable time filling unnecessary FOI requests in an era when people don't know what's real. There's so much disinformation and misinformation, and this kind of behavior erodes public trust. So making everything look rosy and suppressing bad news information may be politically helpful in the short term, but it's a danger to our society and it needs to be called out. The same way an oncologist needs to assess, diagnose, and have an honest and maybe difficult conversation with their patients, so too do public health leaders and the politicians who control the policies and the purse strings need to have an honest conversation about the system. Change isn't always easy, but it is possible even for public bodies. I know, like, where to start at this point, right? Well, why not a public dashboard? The number of people without a family doctor, length of waits for mammograms, the number of people waiting for a hip replacement, and how long. We have the technology, we've seen it during the pandemic. What we don't have is the political will, because showing might mean seeing that things aren't going so well. Clear-eyed assessment, transparency, talking about the hard stuff, this should all be a given. Taxpayers, patients, healthcare workers, we're all adults capable of walking and chewing gum at the same time, because we have difficult discussions ahead of us. BC is increasingly relying on private companies to deliver public services, including surgeries and nursing staff propping up our hospitals. Are these necessary evils or smart fixes? Information is buttoned down tight, and policymakers don't want you to look too closely. Why? And does it have to be this way? Maybe it's time to look at the healthcare system as if it were an ailing patient, requiring as much information as possible to assess, diagnose, and treat in full daylight. Thank you.